If you're on, let me know if you guys can hear me. If you can type in the chat box the number 1, if you can see my shared screen, and if you can hear me, let me know. Othello, nice to meet you, man. I see you. Can you hear me? Just give me the okay. Awesome, awesome. Or even a thumbs up. I can. All right, great. It's working. My mic is working. Great. So, we're gonna probably start in about 4 more minutes. Just want to make sure that everybody, whoever needs to get on, I've been trying to text everybody, just a reminder to hop on. So we got some other people coming on right now, so I'm not sure who that is. All right, looks like Ann, you're there. I see you. We're gonna start at about 4:05. John will be on soon. Then we'll get started from there. Oops, that's me. Okay. All right, awesome, awesome. Justin, I see you. Awesome,
Up,
awesome.
buddy?
What's up, you guys? Yeah, man, we're about to start at 4:05, so we got about 2 more minutes before he comes, before John, and then I'll introduce the community. Do you guys hear that sound in the back? Just want to make sure you hear
No,
music.
I don't hear anything.
No sound? Okay, that's all right. Let's see if I can share. How about now?
Yes.
You hear that? Okay,
Yeah.
okay. Let's see what else I'm sharing here. Basic. Here we go. All right, so we're gonna get back on this. Okay, 1 more minute. We should get started. You guys see the screen and hear the music?
Yes. Yes.
Okay, okay. Awesome, awesome, awesome. Yeah. Um, I'm excited to have you guys on, man. I've been trying to network with people and get them on just so that we can get something started. It's not easy gathering people. Like, so, been a tough one. But
It's the
I'll
hardest thing to do, buddy. But once you get the traction and we start locking down on content and having like really qualified guests like John come on, it's gonna
Mhm.
speak for itself for sure.
Yep, yep. Just waiting for John to hop on and should be good to go.
Hello, I'm here.
Oh, John. Okay, awesome, awesome. All right, so I'm gonna get started. Okay, everybody see my screen, right?
Yep.
All right, I'm gonna stop this music in the background. I was trying to get the ambiance right for everybody. So, All right, so let's get started. So give me 1 second.
I like the background music, Rudy. It was very peaceful.
Very peaceful. All right, I'm gonna have it low so that way we have something to
I'm
move by.
kidding.
So, all right, we'll have it right there. All right, so let's go ahead and get started. I know everybody, I appreciate everybody being on here. So let me go ahead and get started. All right, so good afternoon, everyone. Welcome to our first Zoom conference call for the APP Next Level Community Group on Skool. I am Rudy, and this is my face right here for those who haven't seen me. I am the creator of the APP Next Level, and I created this group just so that we can communicate, network with other people. It's all about networking. I think our community is all about networking plus advancing our careers, and continuing some learning through training and collaboration. This group was made so that we can support each other and take our professional journey to the next level. So I do want to just show the website that we're using called Skool. Let me see if I could share this real quick. 1 second here. Okay. So this is the website right here. If you also there's also an app on your phone that you could download either on an iPhone or an Android. Or this is the desktop version where you can see where we are communicating here. You can post whatever you like. You can see who's a leaderboard on the bottom right. And then I also posted the Zoom link, so whoever needs to tap in can just tap on to here and can go into their calendar and click on the link to join this call right now. So it's an open community for all healthcare providers. So I just want to introduce that part. Now, let's get back. Give me 1 second, and I'll want to make sure I have a proper introduction for everybody. All right, so today I'm deeply honored to introduce our special guest for this inaugural conference call. He's not only a successful CEO, but also someone I had the pleasure of knowing and staying in contact for several years now. Please join me in welcoming Mr. John Palmisano, the CEO of Palm Health Resources. Now, before he gets started, I just want to talk about John real quick. John is just not a leader in his industry. He's a true exemplar of generosity and mentorship. Despite his busy schedule, he graciously accepted our invitation and made time to share his insight with us. He's a driving force behind Palm Health Resources, a company that stands as a pendulum of excellence in the healthcare staffing industry. And what truly sets John apart is his character. He's always had an open hand, extending invitation and support wherever he can. He's willing to make himself available even for events like this. That speaks volume about his dedication to helping others succeed. So let's express our gratitude for John that's here today and make this opportunity the best. So once again, I thank you for joining us. And without further ado, let's give a warm welcome to John Palmisano. So I'm going to stop sharing.
Hey, all, nice to meet you. My
Good to have you on,
pleasure.
John.
Justin Duffy, look at that handsome fella. Always good to see you. Always
Thank
good
you,
to
brother.
see you guys. Thanks. Yeah, absolutely. Right now we're switching to Salesforce, and it has been just mind overload. Salesforce is a beautiful technology for our firm, so we're excited to move on to bigger and better things. So what I'm going to do, I've been telling a little bit about myself, and I'm going to go through the questions that Rudy has asked me, or Rudy, which are amazing questions. I must admit, I couldn't find better questions to answer myself, just to help out your community and be a great resource for anybody that's listening. So my name's John Palmisano. I've been healthcare staffing for 17 years now. I started my own firm over 10 years ago after I realized a lot of the larger firms were, it was just more like a call center type of environment and not really truly recruiting and getting to know their professionals and being able to bring them to the marketplace the way they should be. So we have a full desk model here at Palm Health Resources. So our agents really get to listen to their candidates and then talk to the client about, about their candidate skill sets. So that's really nice because when you have to split that information around multiple people, you're not really getting the justification of a proper representation. It's like talking to, if you go to court, it's like talking to one attorney, but then that attorney is not even the one representing you, to give you an idea. So we have a different type of model here at Palm Health. And an overview of our company. So we're a boutique firm. We have 30 agents total. And we're a full service healthcare staffing firm. We do perm placements, locum placements, which is travel. I know there's a lot of words out there, temp, locums, per diem. We customize all staffing solutions based on the provider's needs. So we also do advanced practice providers is our core focus, but we have other departments, which are our largest focus, I should say. It's not our core. We have multiple robust, departments like allied health and physicians as well, and advanced practice providers. So we do have a great solution here, and it works for the candidates and clients because a lot of healthcare staffing companies, they aren't able to sell multiple service lines to their candidates or clients. They either do perm or they do temp. So if they are only able to sell one product and you're really interested in something they don't have to offer, but they're going to sell you anyway, you're not really going to get what you want because that person doesn't sell that locum service. So even though that's more information than maybe you would need, I think it's so important for candidates to know how it works. People ask me all day long. That's how people need to know how staffing works. So with our agency, we do all of these customized staffing solutions. We can bring you to these hospitals that we work with all over the nation. We specialize in all advanced practice provider specialties. So it really works. So we have over I'd say 1,500 hospitals in our Rolodex now, 500 major health systems and in major metropolitan areas and rural locations too. So we do recruitment in all 50 states.
Oh, wow.
So that's kind of answering some of the information that Rudy had, some of the questions, the first couple questions. And as far as locums and travel, and I think Mr. Duffy can attest to that. He's got 2 excellent assignments presently with our firm. And we customize those both for Mr. Duffy to really meet his personal and professional goals. And it's just so important to us that our model could be more impactful to the community in listening to his needs and making sure that we have a good combination of hospitals so he can keep busy and maximize his income, his professional growth, and look at and work at 2 places that give him different experience and increase his marketability. So I think that's very important to have an agent like that, especially in this congested market of unqualified recruiters that are coming out of school and have never done it, and you're spending what time you have left in the day to talk to a recruiter like myself. I feel honored, and our company feels honored every time we talk to a qualified healthcare provider because, they're just what they're doing for the community and how hard they work and everything. And I think that's a missing component from some places today. And I think any agency that you do choose, you really got to, get a feel for a good agent and be able to work with that person that can represent you and accordingly for what your needs are. One of the questions is, how do you ensure the healthcare providers are matched with positions that align with their skills, experience, and preferences? So that's an easy one to answer from a skill set qualification. I mean, really, you know, you have to get in depth with the qualifications that these clients are requiring. And that these specialties inquire, because if you don't have somebody that has been in the game for a while, to really work with companies, that, you know, have a lack of, you know, information about their jobs, you know, you're gonna get wrong information. So, you know, the key is I think, you know, talking to your recruiter, and, you know, our experienced recruiters, you know, are constantly working with hundreds of hospitals and are qualified to help out in these areas. But, you know, overall, you really want to talk to your agent, talk to him, like how long he's been doing it and so forth, to make sure it's a good match. So, you know, to really give you that good feel of if they're going to be help you out in your specialty. So we really, you know, skill critique on their skills, and also really the needs. And for these days, it's more the needs of the candidate. You really got to find the why, and what the candidate is looking for. The why is probably the most important thing. Some people don't know what they want to do, and they can't really tell you, or they think they know what they want to do, but they can't really, you know, they tell you one thing that they may, you know, that sounds good, but once you really find out the why, and who, what, when, where, and all those questions, you really could put it into perspective and help somebody a lot better, um, than just off of their initial, you know, answer. So it really takes a good technician to work with somebody. And that's what we do. Listening is key. Listening is key. And our qualifications is key to really make sure you get the right candidate. The next question is, what measures do you take to verify credentials and qualifications of healthcare providers before placing them in locum tenens positions? Well, similar to what I answered, you really just have to talk to the provider and verify that they have the procedure, their actual proficiency in the procedures, but they're not proficient. Everybody likes to, you know, sugarcoat a little bit, but I think you have to have a real understanding of what the requirements are, and that's where we get specific, and ask for like how many procedures they've done in that, you know, what do they feel comfortable. And if people feel comfortable talking to you about that, of what they may lack or what they do, then you're going to have a lot better opportunity to place that person. So that's really getting people to feel comfortable and telling you really where they are at with their skills. And it says, can you walk through the process of finding and securing a locum tenens position with your agency? Absolutely. So we have, I'd say, 800 postings right now at our firm, all on palmcareers.com. So anytime that you want to apply for a position, you can apply there, and you could also, I mean, you could email me directly, and I'll route you to the right recruiter. We have a, you know, a slew of ways, but once you apply for any positions you want, it goes right to a recruiter that is matched for your specialty. So we have those skilled recruiters ready to help you out for every last need. And we don't work natural bankers hours. So, you know, some of us are here to 7, 8 o'clock at night. Some of us take conference calls at 9 or 10 o'clock sometimes. Justin and I can vouch for that. We've been on calls at 10 or 11 o'clock at night. Whenever Justin's available, we are available. And that's just the way it is. So, you know, knowing that's a good thing, how dedicated your recruiter really is to helping you. If they're never available when you're available, it's going to be tough to really get what you're looking for. What kind of support do we offer to healthcare providers during the assignments, and how do we ensure the satisfaction and well-being? This is key. This is a great question. I really like this question. Like, I just talked to a lady who's never done locums, and she's down in Mississippi, and we just placed her for her first assignment. And if you don't manage expectations properly, people do get upset no matter what the outcome. You know, as long as you tell them and are honest with people and upfront, then they understand like what to do in those situations. So we have a back office that goes over timesheet keeping abilities, all the travel. We have dedicated travel support and timesheets and payroll specialists to answer with any questions. And of course, like Justin and many other providers, they just text me directly too. And if I can't answer it, I send it to them. But either way, we're all here to help and to make sure that One of our credentialing specialists is on board, you know, with you know, has all the information. And then your agent makes sure we walk you through the whole process of credentialing and managing all expectations. So you have a full service staffing agency for travel, and permanent placements too. We still do a lot of perm too, but you have a full agency, for whatever it is you need. And we do all specialties for advanced practice providers. So, um, you know, physicians and allied health too. So that's really what we do. Make sure we every step of the way we have, you know, help you along the way. Personal, professional goals that interlock. We're here for you. Success stories or testimonials for healthcare providers who have worked with our agency in locum tenens positions. Justin Duffy, right? Him and I have known each other for about 5-6 years now, and we met in person down here in Fort Lauderdale, Florida, and we had a beautiful lunch at Coconuts, right on the water, which was great. I love their lobster BLTs. Justin and I met, and we talked about his goals and, you know, his aspirations, and you know, we just really hit it off. And you know, he's working at 2 assignments presently, and he's making probably more than some surgeons. He's doing great. He's making a great life for himself. We put him in 2 places where, you know, he's putting in a lot of overtime, you know, and we provide time and a half for PAs, you know, for most contracts, not all. Like some clients won't do it, but most of them do after 40 hours a week. And, you know, he works sometimes 60 hours a week. So that really adds up, that time and a half. And it really meets his needs personally. So you know, in other and above beyond just Justin, we have a 4.9 out of 5-star rating on Google, where you can see 100 testimonials from our candidates. Some of them we've placed 4 or 5 times. You know, I've had locums travel us for 8-9 years. So anybody that you want to talk to, if we do work together, any testimonials, we're more than happy to share that.
Yeah.
What types of healthcare facilities do we work in, and what geographic areas do we typically place? So that's a great question too, because we work with mostly healthcare systems. We work with some private groups, but healthcare systems is more who we work with. Just because they have so many more needs and opportunities for our candidates, and they, quite frankly, have a lot more money because they have a lot of different service lines, which more money is a win for our candidates and a win for us. So those health systems are where it's at. You know, there's always a lot more, you know, revenue coming through there. Some private groups we work with as well, but healthcare systems seem to be where we've always been able to make the best match. Most clinical matching is, you know, there's more opportunity for sure.
Okay.
So, and we do all 50 states. And you know that, and we can provide you, you know, we customize searches too. So what we don't have, you know, if we don't have it, then, you know, we have a very strict strategic process of making sure that you're available for when we do have it, so that you know, you're matched to the right job for as soon as something comes up. Once we put you in our database, if we don't have it now, then, you know, you're going to get calls about the opportunities in the near future at some point when we do. So you have somebody working for you while you're working, and that's always great. It's a free service. We're working for you while you're working. And then his last question for me was, how do you handle any issues, challenges that arise during a locum tenens assignment, and what resources are available to support other government providers in these situations? There's always some issue. I feel like with not an issue per se, but like locums is not perfect. You know, they're filling a gap, you know, for their department, and they're either short staffed, or somebody in the department may be scaring staff away, or, you know, maybe they have everything right, but they're unorganized. You know, you're dealing with a lot of moving parts. So somebody would be lying to you if everything's perfect. You know, if everything's perfect, then, you know, why are they having needs, right? You have to ask yourself that. So, you know, it's about, the biggest thing to us is finding out why it isn't perfect, and maybe perfectly imperfect, or whatever that is. And somebody out there's looking for that, or somebody's looking to help in that area. So it's really about just making the best match, and when issues arise, there's no problem that doesn't have a solution. It's a matter of just coming at talking to people, listening to them, and then providing a solution that's a win-win for both parties, so everybody's happy. But our resources, as far as what we have, is you're of a full service firm, so you have front office, back office. We have a new workflow analyst on board, and you have me. So
Yep.
that's why I think we're great. And one last thing is we do a lot of long-term locums too. So we don't want to wear you out with 10 different part-time jobs. That you don't want to be a professional credentialer. Some of the larger firms, they will wear you out with a lot of part-time locum jobs. Be aware of this. If they're just trying to plug you in as a body, be aware that, you know, you're going to do all this paperwork and you might get 4 or 5 shifts a month. I mean, is it really worth that, to go through a credentialing, and how long is it going to be for? Those are good questions to really ask. Are they going to extend me? They have a history of extending me. Our biggest thing is have a long-term locum relationship. So locum is the new perm because these facilities are, you know, short staffed with experienced talent. So it's important to know where your best resources are going to be. And that concludes my Q&A for today.
Awesome, awesome, awesome. I do want to give the floor to Justin so that he can, he's had experience with you, John, and I want to see what he
Yes,
has to
sir.
say.
Absolutely. Let him have it, Justin. Bad and good. Whatever you got.
Hey guys, can you hear me?
We can hear you. And just give us your background, Justin, if you can.
Yeah. So my name is Justin. I work as a CT surgery PA. I've been working as a CT surgery PA now for about 6 years. And I've had the privilege of working with John for at least 3 of those years. And I could say that from the vantage point of working with like multiple different locum companies, I could speak on what I've seen, what I've experienced is different about John's company and what sets him apart from the other ones, especially some of the major ones that I've worked with. So right now I'm currently in Daytona Beach, Florida, and I also travel to a suburb area of Chicago, Illinois. And we've been on this back and forth contract contracts for like the last 6 months, and it's just been like thoroughly enjoyable to, number one, see different places, right? Like that's what life is about, is new experiences, new interactions, new teams, and constantly stretching yourself to grow. So that's been an amazing opportunity to work with like different surgeons, different hospitals. You see the different ways that that teams operate, the good, bad, and the ugly. But it's all about the patients. And so when it's all said and done, the variety of the experience that you bring to the table, each place, you come with something different because you've seen such a wide array of different uh, modalities and approaches to medicine. Um, and so with John's company, the one thing that I could say is the main thing that sets him apart is the consistency in the communication and the relationship that I have with John. Um, with working with other major companies, I'm not going to say any names, but I've worked with other companies that are very large, and you deal with different recruiters all the time. And that's one of the things that I can relate to what John was saying about, talking to an attorney that may or may not be the one that's the attorney on your case. That's such a great illustration. Um, at the end of the day, these people are dealing with your livelihood. This is your job. This is where you're going to be spending the majority of your time. And so having somebody that you could trust, having somebody that you could rely on their communication, and that they aren't just, kind of throwing you to the wolves, but they actually are cross-checking and making sure that, you're a good fit for that particular assignment. That's so important. Some people just want to fill the need, and they don't really care about matching the right person with the right place, which is scary, because you could really find yourself in a bad position sometimes. You know, you could be overmatched for that particular location. You might not. You may be, um, you know, making sacrifices and moving halfway across the country for something that's not even a good fit. You know, so it's a serious business, to make sure that you're in the right place, right time, and to have somebody that listens, right? John and I, we talk very regularly, at least once a week, and we touch base, and he listens to me. He, you know, makes suggestions. I follow his advice. He's very well, acclimated to this locum environment, and he knows what we go through. So it's having somebody that's relatable and that you could speak with in confidentiality, and know that their, um, you know, their response is valuable to your decision making. I think that's super important. And so everything is personable, it's custom, it's not cookie cutter, and that's what I love about working with John. So I plan on staying with John's company till I retire.
That's awesome. Awesome. All right. So Justin,
Thanks, buddy. Appreciate the kind
Of
words.
course,
that's
of
good,
course.
man. So Justin, I got a question for you.
Yes.
All right. So you're a PA, you've been doing cardiothoracic procedures. So when you're going to a new hospital, for example, are you, let's say, do the hospital require you do, I have experience doing multiple procedures so that you can get privileged to do those things? Like, how do you show proof of that? Or do they trust you already to just go in there? Do you have to provide something?
Yeah, so a lot of it is your resume and your background. So you're providing them with the CV that shows your, work history, and your, you know, any professional experience that you have should all be on your CV. You should also be keeping case logs
Mhm.
that, demonstrate the variety of cases that you've assisted in. And then, of course, your references is very important too. So having good references, you usually need three references: one from a doctor or a surgeon, another one from like a team supervisor or team leader, which could also be a surgeon, and then one from your colleagues or a PA that you've worked with, either in a recent assignment or in the past. Preferably somebody that you've worked with within the last year that could vouch for your experience.
Okay.
And then as far as the skill set, like, you just want to make sure that you're transparent with the place. Like John said, you know, um, they have hundreds of hospitals that they contract with. So you don't have to feel like you're a perfect fit for every place. You know, you could be very transparent with your skill set, your strengths and your weaknesses, and allow them to put you in a place where you could be a good fit. So that's, I think, has been, one of the things that I think has helped me a lot, is just not like over presenting myself. Um, you know, I'm very coachable and humble about my experience, and so, you know, you're going to have some strengths and weaknesses no matter what. You know, not everybody is a point guard, not everybody is a shooting guard. That's why the teams have different positions, because everybody has different strengths and weaknesses. So you don't have to try to be everything to everyone. You know, just be honest with your skill set and let them find the right place for you. And that's again why I like working with John's company, is because he is constantly thinking about, you know, where I fit in the roles that he needs.
Mm, okay. And then I guess that's a good point. How long does credentialing happen? Is it expedited with your company, John? Or is it the regular 3 months that
You
provide?
know, it depends on the client. Unfortunately, we're at the mercy of clients, no matter what everybody says, whether they're willing to do emergency privileges or not. We are at the mercy of the hospital for that. So it just depends if the client will let us do that or not. But the most important thing is that if you have an experienced agent like myself or my agents that work for our firm, they have so much experience working with the different clients. They won't run you on a wild goose chase. and say, go here, when you really need to start somewhere in 2 months, and send you an assignment that won't start till 4. That's a very easy thing for a new person that doesn't have any experience to make that mistake. I mean, 90% of the industry really is not qualified to time up accordingly, to be honest with you, because you have to have experience placing people at these clients. And if you haven't seen it, you only know what you've seen, what actually is true. So I think that that's so important, when you're talking to a recruiter, how long have you been working at your company? A lot of these firms these people are in and out of there so quick. Like, how do you have the time to have any knowledge or value for your candidates? So you gotta question that, and that should give you ability for them to make the shots. At least make them ask the hiring manager how long it takes, truly, you know? So you always want to make sure that you're not sitting there not producing income for yourself or your family. That could be a really big problem.
Does
And
the
if I piggyback off that, John?
Sure.
So like one of the good things about working with John is he knows when my contract is supposed to end. So he'll start, 2 to 3 months in advance, he'll start looking at other places for me in case I need to get another license, or so this way we can get the ball rolling on the potential next spot. So he knows what's hot, he knows what's coming up, he knows, what hospitals are going to be having needs. And so he'll start that ball rolling. He'll start that process rolling. And I think that that's also why it's so important when you're trying to establish yourself as a locum. If you're looking at it like wanting to do this as a long-term endeavor, to work with one company, because then they know exactly what you have going on, versus trying to juggle multiple companies and the right hand doesn't know what the left hand is doing. That you could find yourself in a pretty sticky spot with that approach. So, and I have done that. I've worked with 2 or 3 companies at once, and it's a mess. So working with just one company and having multiple assignments with just that one company, there's always good continuity in the assignments and the rollouts.
Yeah, I think you answered my next question, how you keep up with the state license, and you got to be ahead of the ball game in order where you start your next one. So
John has specialists that work with your credentialing, that keep up with like when your licenses are expiring, when your ACLS is expiring, when your BLS is expiring. I mean, you got to do your own due diligence too. And at the end of the day, you're responsible for your own stuff, but it does help when you have Jamie is the name of our person. She's awesome. I think she's like based out of Colorado or something, right, John?
Jamie is phenomenal.
He's
Best credentialer I've ever seen. She's amazing.
Amazing.
A lot of credentialers are kind of like lack communication, and I've hired a few of those over the years, admittedly, and it never worked out because communication is the key to bringing it all together in transparency for credentialing and paperwork. So it's not one of those games where you just want to submit your paperwork and you don't hear back. You need to know that your information has been received, because if not, you don't start work. So you have to have somebody that says, hello, yes, I received. Thank you so much. This is what you need. One thing I always recommend is make sure you get them to give you a full list of hospital requirements immediately. When you start to get credentialing, always get a full list so you have what the hospital requires. So then that way, in one shot, not piecemeal together in last minute of any missing items.
Yeah, absolutely.
I know we have some members on this call. If anybody have any additional questions for John, you can ask. Let's see.
Hey, Rudy.
Yeah.
This was great, man. Like,
this is great.
I love this. This was our first meeting. So what I could do is, John, if you want to do something like this once a month, I could start
We
I
could
could
do
start
something like once a
getting,
month and start getting people to participate and
yeah,
sharing their
yeah.
experiences and so forth and blow it up, you
I
know?
know
We
a
could
lot
have
of
it.
people that I could invite
Hmm.
to the meeting.
That'd be
Yeah.
cool. Me too.
Yeah.
Just to get them on here, especially like new locums
Yeah.
that like want to know how locum works. We can invite them to
Hmm.
this once a month platform. Say,
Once
hey,
a month.
listen, we have this once a month,
Mhm.
and this is, this will give you a lot of information and give you like real life, and give providers the opportunity to say their experience, just like you did. I think that'd be great for people,
Yeah,
whether it's
yeah.
perm, locum, whatever. I 100%. I think so
And
too.
then we could introduce like some members of your team, and like
Yeah.
for an example,
Hmm.
Lisa can speak about the travel. Um,
100. Yeah.
Jamie can speak about the credentialing piece. Yeah,
Hmm.
that'll be
And it doesn't have to
100%.
be, and it doesn't have to be long. I know we're kind of going over a little bit, but I mean, this is all good information for everybody can hear about.
This week was just a little crazy because we're going through this Salesforce thing and I'm not like a tech expert. So it's like mind overload.
Yeah.
There's
Yeah.
a lot of tech in Salesforce, but it's such a great platform.
Yeah.
Um,
yeah,
but yeah, absolutely. I'm happy to do it. I think once a month's a great idea. It would blow up a lot of business for
Mhm.
everybody and it'd be a good
Everybody.
thing, nice little network for people.
Cool,
yes,
cool. Yeah.
absolutely.
So what
So yeah,
And I
send me
like
an
your
invite once a month.
yeah,
I like your platform, Rudy, that you created on your website.
man, thank you. Thank you. Thank you.
Yeah,
Yeah, it's
And
a great idea, buddy.
so I want to thank everybody for attending. John, thank you for doing this.
Yep.
This not only explore your company, but also the platform for Skool. And
Yeah.
you guys can spread that link to everybody who's in the health community. That's APP Next Level. For this Zoom call, I'll have all the information required in order for you guys to get in contact with John and his company. His website is palmcareers.com. So he's also found on LinkedIn. He's all the job search, all the listing of
If you send me an
positions.
email from anybody who participates monthly, I
Mhm.
could distribute, a whole bunch of information for them.
Okay, cool, cool, cool,
we
cool.
We could blow up the next one, and get a bunch of people in there.
Yep. And then we
do
can
you
talk
want to
about
do
all the positions that are available too. Because I
We
know
could definitely do that.
yeah, I know this was more like a general introducing Palm Health resources for you guys, but there's a lot of information on the website regarding all the positions and what you can qualify for. Mm.
yeah,
Thank you. Appreciate that. And absolutely, we could just bring a bunch of providers over and make it just a rewarding conversation, so they
mhm,
can hear from other providers, what's going on.
Mhm.
And start to help people who are getting the runaround too, with trying
right
to
on.
find locum positions and like they're getting like, they're working with 10 firms and they don't know what to do. There's a lot of people
Yeah,
like that.
yeah, a lot of
So yeah,
people.
Mhm.
I have a ton of providers that would find this helpful. So let's set up a time for next month and then shoot me a link and shoot like some topics and so forth and like a schedule. And then
Okay,
we'll send an email blast out on our side.
sounds good, man. Appreciate it.
Yeah, no problem. Well, guys, gentlemen, ladies, gentlemen, thank you for your time and have a great week. Thank you
Thank
again.
you.
All right,
Thanks,
guys.
everybody.
Thank
Thanks,
you
Justin.
again.
Thanks, Rudy. Thanks, guys. Appreciate it.
Have a good one. All right.